Peace and blessings, everyone. Welcome to Ask Dr. Jeff, the interactive Zoom experience to discuss all things photobiomodulation and Lifewave. This is episode number 72. I am your host and facilitator, Dr. Jeffrey Hubbard. I'm a medical doctor here in the Dallas-Fort Worth Metroplex. I have been interacting and utilizing the photobiomodulation technology from Lifewave now for 2+ years. I'm really excited about how vital this can be for our health and wellness and helping us to prevent all sorts of issues and symptoms, and helps alternatively with all sorts of different things in a natural way to bring your body into optimal states of wellness. So here on Ask Dr. Jeff, we are frequently discussing new topics surrounding photobiomodulation or light therapy. In addition, I share my insights about what I've been able to appreciate from my work with patients and clients and different individuals who are interested in achieving all sorts of benefits to their health by utilizing my expertise and or the light therapy patches. All right, here's my trusty prop here. Here is a Lifewave light therapy photobiomodulation patch. As you can see, it has a fiber mesh there encased in a liquid, a nanocrystal proprietary blend. So there's a series of organic materials that they put on top of that fabric mesh before they encase it with the plastic. And they then apply a adhesive to one side of the patch. It is an adhesive from 3M. It's actually a very solid way to adhere to either your clothing or your skin. It's pretty durable. It works really well as long as you don't get it wet. So we apply these patches to certain acupuncture locations on the body, and we leave them there for 12 hours on, 12 hours off, or 24 hours on, 24 hours off. It is a very simplistic process. It's not difficult. It's easy to use. For the most part, here in the Lifewave family, we just say peel and stick, right? If you put it in the right place, maybe just a little bit off here or there, you're still fine. It's going to do its job. The one I just showed you is called the X39. There are 12 in total now. The X39 is by far the most popular and currently has the most benefits. It raises a molecule called GHK copper peptide, which has been studied since the early 1970s. It's not unique or novel to Lifewave. It's actually been researched and investigated for 50, almost going on 60 years, since the early 1970s. And Dr. Lauren Picard, who is a professor at Harvard, was the originator of isolating this protein and figuring out exactly how it works. And so what it does, guys, is it goes into the cell, it goes into the nucleus, and it helps with something called gene expression, which simply means that our genes are sequences of nucleic acids that are in our DNA. And they're utilized to make certain proteins. These proteins are responsible for all of the different processes that happen inside the cell. This bad boy influences 4,192 of those genes to date to do all things that are healthy and supportive and productive to our body. Wow, what an accomplishment. I call it simplistically profound science. You're simply repurposing your body heat or infrared light back into the skin to raise the nature, the sequence, the production of this particular molecule. After that molecule is increased, it does all of these other things. One of the major things, and the reason why the X39 is so popular, is it helps us to activate our stem cells. As we age, ladies and gentlemen, our stem cells decline. So about age 35, we're operating at about 50%. At age 65, we're operating at about 10% of our normal stem cell capacity. So that has a lot to do with our aging process. It has a lot to do with why we slow down, why we have aches and pains, why we have, symptoms and things that just don't make getting older very easy. So everybody's excited about getting younger. Everybody's excited about being more vibrant and not having any health issues. So that's the reason why Lifewave has grown exponentially over the last 4 or 5 years, because of the implementation, the science of X39, and the fact that in any other capacity, getting stem cell therapy can be challenging, it can be invasive and painful. Sometimes it can flat out just not work. And quite honestly, the most biggest thing is that it's very, very, very expensive for injections. And the supplements that are becoming more popular, they take very, very long time to work. Guys, within 90 days, so you're going to have an effect. If this is the first time that you've heard about this, excited that you're here because this is a game changer. It's a revolutionary. The testimonials around the globe are extremely impressive. And the reality is there's over 90 clinical studies on this technology. It's patented over the entire planet. Nobody can take this technology. Nobody can repurpose or re-engineer this technology. So that lets you know that it has to be very dynamic in regards to the science, and it has to be very well documented as regards to the science. Otherwise, those certificates and documents would not be provided to us, right? So that is Lifewave and photobiomodulation. It's a mouthful in a nutshell, all right? So we're going to now talk a little bit more in detail about how we use the patches. Today, we're going to cover a protocol, guys, for appetite suppression, appetite control. And downstream of appetite control is obviously weight loss and the better appropriation of the nutrients and the calories that you eat to be able to nourish your body, okay? So this is a little bit involved. So that's why I wanted you to have your pen and paper out and get ready to take some notes, okay? So here's the deal. There's 3 days in this protocol, 3 specific days, day 1, day 2, and day 3, all right? That is one cycle of this appetite suppression protocol. You need to go through 6 cycles of this appetite suppression protocol, all right? So that means you're going to have 18 total days of this appetite suppression protocol, all right? Every day, you are going to wear the patches for 12 hours on and 12 hours off. They should be worn during the day. Obviously, your appetite should not be in control while you're sleeping. So we're going to make sure that your appetite suppression protocol is going to occur during the hours that you're awake. So depending upon your sleep cycle, let's say you start at 8, you would conclude at 8. All right. So that would mean that you would need to consume all of your meals and everything that you're going to have between that 12-hour window, between 8 and 8. All right. So this is not magic. This is not, a silver bullet, right? You're going to have to eat healthy. You're going to have to drink a lot of water, and you're going to have to make sure that you are really emphasizing a healthy lifestyle, all right? So not only calorie control, which hopefully is going to be easier with these particular patches, but also the types of foods you eat, all right? So I'm encouraging nutrient-dense, well-balanced meals. So they should have starch, they should have protein, they should have vegetables, and they should have nuts or legumes. Now, I really am not a huge supporter of dairy, so we're not going to include dairy in that. It should be predominantly fruits and vegetables, and it also should be healthy, lean protein and healthy starches. So try to stay away from the things that are bleached, like no white rice, no white bread, no white pasta. You want to eat wild rice, quinoa, your healthier types of starch, couscous, spilled flour products, all right? If you gotta have bread, do Ezekiel bread. You can get all of these things from the health food store, all right? All vegetables are fair game. All fruits are fair game, with the caveat that you wanna keep your carbohydrates and your sugars lower than the other items that you're gonna be eating. So you don't wanna eat predominantly starch. You don't wanna predominantly eat sugary things. You wanna emphasize your protein. You wanna emphasize your veggies. All right. Again, lean meat, right? So think fish, think chicken, think, if you need to do red meat, just make sure it's lean, grass-fed, that sort of thing. If you're going to get ground beef, get the 90%, to 10% fat, that sort of deal, okay? All right. Every day, here's going to be what you apply. Again, stick with me. This is going to be intense in comparison to other protocols that we talked about, okay? So on your abdomen, we have stomach 23 on both sides. You're going to put SP6 on stomach 23 on the left. And you're going to put glutathione on stomach 23 on the right. All right. Eon is going to be worn on conception vessel 12. And that is 6 finger widths above the navel. So you're not going to go below. Below is governing vessel 4, conception vessel 4. Conception vessel 12 is going to be 6 finger widths up. All right, so take a look at the screen here. Here's my abdomen, here's my navel. So you're going to have 4 fingers, 2 fingers. Here is conception vessel 12. It's right underneath your breastbone. Okay, got that? Conception vessel 12, that is where Eon goes. All right, now you go 3 fingers up. Here's my navel. You go 3 fingers up and 2 fingers out. All right, so about here and here.
I'll get in the bed, I'm tired.
Stomach 23 on either side. So left side is SP6 complete. Right side is glutathione. And I'm touching my right and left. So it's going to be opposed for you, obviously. But your right glutathione, your left SP6 complete. All right. And then right about here is Eon. All right. So again, guys, that triangle we talked about is right there again. All right. So you wear that every day. The other element is that on day 1 to those 3 patches, you're going to add a second SP6 complete. All right. That second is going to be on your left leg at spleen 6. Now, spleen 6 is just about 4 finger widths above your ankle. On right spleen 6, the same point on the other leg, you're going to add a second glutathione. All right, so there's going to be 2 SP6 and 2 glutathione and 1 Eon. Got that? All right, so that's day 1. All right, so remember the patches, the 3 patches on your abdomen don't change. You put them on the same way every morning. Oh, and guys, you want to use fresh patches each day, okay? So you take these off, you're gonna throw those away, and you're gonna take out brand new ones and apply those. Okay? Day number 2, abdomen stays the same. Eon conception vessel 12, SP6 stomach 23 on the left, stomach 23 on the right is glutathione. All right. And then you're going to move the second set to stomach 36. All right. So let me show you that. Okay. So stomach 36 is about right here. It's going to be 4-finger width beneath your kneecap on the outside of the shin. So it should be right about there. All right. So you're going to put glutathione on the right, and you're going to put SP6 on the left. Okay. Again, that's going to be the change. So instead of putting them above your ankle, you're going to put them just below the knee on the outer portion of the shin. Again, that's stomach 36. Left SP6 complete, right glutathione. The patches on your abdomen stay the same. That's day 2. Day 3, you're going to move them to kidney 3. All right. Kidney 3 is going to be where the second set of glutathione and SP6 go. So kidney 3 is just behind the inside of your ankle. The bone that protrudes out that we call the ankle bone is the medial malleolus, okay? Just behind that, in between there and the Achilles tendon, is kidney 3.
Mm-hmm.
All right, so on the left side, you're going to put SP6. On the right side, you're going to put glutathione. Again, the abdomen patches stay the same. Do not concern yourself with wearing the same patch because you're simply wearing them for 12 hours. So you can wear as many patches as you want within that 12-hour window. All right, so having 2 glutathiones and 2 SP6 completes is not a big deal. Your body will be fine. Actually, you're increasing the appetite suppression there. All right. So again, daily, Eon, conception vessel 12. On the left stomach 23 point, you're going to put SP6 complete. On the right stomach 23 point, you're going to put glutathione. Every successive day, 1, 2, and 3, you're going to shift the second set of SP6 complete, always goes on the left side. Glutathione always goes on the right side. So you're going to move from spleen 6 to stomach 36 to kidney 3. Day 1, 2, and 3. That's one cycle. You need to complete this cycle 6 times in order to bring your body into appetite suppression. And, you know, over the course of those 18 days, you should really notice a significant difference in your overall gut health, in the amount of weight that you're carrying, your waistline, bloating, all of those things. Your appetite should be less than normal. You should be drinking a lot of water, you know, at least 8 to 10 glasses a day. That's important. If you want to rev it up, you should, meaning that you're going to drink 2/3 of your body weight in ounces. All right. So if you weighed 100 pounds, you would be drinking 66 ounces. So you can calculate that on your own. Just type in your current weight, multiply it by 0.66, and that is how many ounces you should be drinking daily. All right. That concludes my discussion. I was a little bit long-winded, but you know, we always can stay a little bit later for question and answers. So first of all, you know, let me say this, guys. These patches have not been approved or evaluated by the Food and Drug Administration as a type 2 medical device, which simply means they do not heal, treat, cure, or prevent any medical condition. So if you have a question specifically about something that's ailing you or a family member, please don't discuss diagnoses or specific diagnostic names. Just talk me through the symptoms, follow me, give me a narrative, and I can pick up what you're putting down, okay? If you look down at the bottom of your screen, you'll see the reaction icon, okay? That reaction icon allows you to raise your hand. Emiko has already done so. That helps us to kind of keep sequential order as we're asking questions. And guys, if for some strange reason I can't figure out what we're talking about, or if we need to have more specific discussion, you can always send me an email. You can always have a discussion offline where we can speak a little bit more in depth about what's going on, and I can perhaps provide some additional insight. All right. So without further ado, let's go ahead and give the floor to Emiko. Please unmute yourself and ask your question.
Hi, Dr. Jeff. Thank you. So I had a question about the head protocol with the hat. Is there some other way to do that? I have a client that really needs to do the hat protocol, but one, she doesn't wear a hat all the time. Okay. And working outside, she gets hot, sweaty, the wind's blowing, the hat blows off, whatnot. So is there another protocol that would be comparable or helpful for the head protocol?
Sure, you could apply the patches with hair clips. That also works. I mean, the predominant reason why we use the hat is because typically most of us have hair and the patches just don't adhere well to hair, but you can get those little clips. And so, you know, on the temples, you know, you have energy enhancer here, tan on the left, white on the right, and then you have energy enhancer here. You know, the ones in the front probably are okay because usually there's not too much there that prevents you from patching. It's the one in the rear of the head on the occipital lobe, and then the two here at the top, okay? So if you can situate the eon and the glutathione here at the top of the head with clips, and you can secure the one in the back of the head with a clip, I think she'll be okay. Because again, they don't have to be directly on the skin. They just need to be within an inch to an inch and a half of the proximity of the body heat so that they can be activated and they can reflect that energy back into the skin, okay?
Right. Okay. And the other thing is this would not be good as a nighttime protocol because of glutathione, correct?
Well, we tend to shy away from glutathione during the evening when people start, simply because there tends to be a little bit of a detox, and depending upon how the person responds to the detox, it can disturb their sleep. So that's okay. The thing there. So if she's already been wearing glutathione and is already acclimated to the way glutathione makes her feel, then it's no issue wearing it at night.
Okay, thank you very much.
You're welcome, ma'am. Great question. All right, Bill, your turn, sir. Go ahead and unmute yourself and ask your question.
I'm so excited, but my hand doesn't work as fast as my brain can process what I hear from you saying and doing all this stuff. How fast can you get this up on YouTube tomorrow?
I will make it a point to make a separate video where we actually put the patches in place. And, you know, so for all of those who are currently subscribed to the channel, you'll be able to see that it'll go under Ask Dr. Jeff Educational Series. So been working on some additional videos in there. I haven't shared all of them because I kind of wanted to unveil it. But since we're talking about this specific one, I'll make this one public so that everybody can see.
And can you make the recording of tonight early tomorrow morning?
Yes, yes. As soon as Zoom sends it to me, then I can upload it and get it going.
Thank you so much. This is so exciting.
No problem, because I know, guys, this is a huge topic. For those of you who are distributors, for those of you who are in the business of introducing Lifewave to other people, obviously weight loss and appetite suppression is going to be a really pretty feather in your cap when you begin to introduce this to people. So I think getting a good understanding of this protocol, or having your own experience with it, with your own testimonial, so that you can speak to it. For those of you who are going to dive right in, my suggestion is to take some before and after pictures so that we can see all of the amazing changes that are happening with you throughout the course of those 18 days. And, maybe we'll have a appetite suppression party and we'll just show all of our different pictures and stuff like that. So for those,
what is the difference between your YouTube channel that we subscribe to and your educational series?
Nothing, it's just a different playlist. So YouTube allows for you to 3 categories. You can make the video public, you can make the video what we call unlisted, and you can make the video private. All right, so unlisted means that you need the link associated with that particular video. So when I do one-on-one consultations with people, we record the video, we record the consultation, and then I record a separate follow-up video explaining how everything we discussed should work. And if they have any additional questions and things like that, I make sure that it's real thorough. So that's considered unlisted because the general public does not need to see my individualized consultation with whomever I'm speaking with. So a lot of my educational lecture series is unlisted, and I send it out based upon request, for certain protocols and things like that. It will eventually be made public, but as of right now, it's not.
Thank you.
Yes, sir. All right, Anne Marie, it's your turn. Go ahead and ask your question.
Hi, Dr. Jeff. Thank you. You did the high blood pressure protocol last week, and you have day 1 and day 2. And I just wanted to ask, how many times does that need to be repeated for the results, or is it just a day 1 and a day 2?
Well, that's what I understand. It's actually a protocol that I learned about recently, and in 2 days, it's supposed to make a difference. Now, you can continue to do it, but they recommend that it's a 2-day process. So if you want to continue, just like you continue here with this appetite suppression for 6 total cycles, it just says that 1 cycle is sufficient, but maybe you might need 2 or 3, but it's a lot easier with 2 days. It's not as intensive. So if you haven't noticed a change, then I would continue. Sometimes our meridians and our flow of energy through our body can be a little bit stubborn. So sometimes for each individual, you have to do, like for instance, if you're going to the acupuncturist, you might have 4 or 5 sessions before you really start to notice a difference. They have to manipulate those points and those meridians to start to get the energy to flow freely again. And also, got to deal with those underlying things as well. So again, just want to reiterate that this is for blood pressure support. This is, again, not going to be a cure or a particular treatment for blood pressure. I'm not suggesting that you stop taking your medicines or anything like that. This is just to bring your body back into balance and help your circulation to be more appropriate. So I really encourage you to share this with your treating physician. Make sure they understand what you're doing. And also you're keeping track of this with your blood pressure cuff. So if you start to notice that there's some change in how your blood pressure is normally, then it seems like the protocol is going to start working. Your circulation is improving, the flow of energy through your body is improving. You're starting to heal. So that's what we want to see, is that, your body is recovering from whatever trauma or issues or symptoms that may have been going on for however long.
Thank you so much. I'm sorry, I shouldn't have mentioned that disease name. I should have thought about that first.
No. I just want to make sure we're clear, because we just have again, these videos are live on YouTube. So we just don't want anybody to randomly see this and think, oh, wow, all I need is these patches and I don't have to take my blood pressure medicine, or, we want to just be very clear and frank about what we're saying, that this is an adjunctive therapy that helps in addition to the other things that you're doing to bring your body into balance and to help with any sort of issue that you may be having regarding blood pressure.
Thank you so much.
You're welcome, man. All right, Adele, how it's your turn? Go ahead and unmute yourself.
Hello, Dr. Jeff. Thank you for doing this and calling on me. I missed last week, and I would love to know what that's Anne Marie's protocol, what those patches were for the day 1 and day 2, please, if you don't mind repeating it.
No problem. It's actually a little intensive. So what I'll do as soon as we get off, I'll email you the recording from the video last week.
Okay, perfect. Thank you. Okay.
You need enhancer and you need Eon.
Okay.
Okay.
Well, okay. Thank you very much. And so it was 71. Is that right? Recording 71?
Yes, ma'am.
Okay. Okay. Great. Thank you, Dr. Jeff.
No problem. No problem. And I'll send it to you just to minimize any confusion.
Okay. Thank you.
All right, guys. Have any more questions?
It uses specific frequencies of.
What's up, Mr. Hairston? How are you, sir?
Doing good, Dr. Jeff. How are you today?
Oh, man, I'm excellent. Excellent. Good to see you, sir. How are things going?
Good. Great to be here. It's actually going pretty well. I was trying to give people a chance to get their questions in, and if not, then I was going to give a little update. You remember there's a whole lot going on, so, one step at a time. But my neck was getting a lot better as far as healing. X-rays and all went well. Doctor says it's coming along well. I'm off of therapy and all, and that's going well. But one of the other things that I noticed was I'm waiting for my next A1C.
Okay.
Because the last one I took, my diet was kind of way off before I went into surgery, and I was expecting it to be pretty high, and it wound up going down.
Good.
So I'm like, okay, well, let me see what the next one is, which is coming up now. I should be taking it when I see my doctor now. And if that one is just as low, because the diet has still been kind of crazy and all, then I think I've been kind of saved. And I've been basically on X39 and Eon, and every once in a while when I can, the glutathione. So even though I'm expected, I'm looking for the back end and everything and all that to go in one way, and still that's the worst thing. It's like there's a lot of other little things that are happening at the same time. And even though I can't get my doctor to say it, remember I was telling you about that problem with my back and the spine, and where the nerve roots start to stick together for scar tissue and all of that, and they were telling me that that's just going to get worse over time. My last MRI, I forgot to mention that to you before. It's been 2 years since that last surgery, that fusion in my lumbar, and the nerve roots were still not stuck. They didn't come back together again. They're not clumping. So it's still not clumped. I asked him why. He told me he couldn't explain it to me. Because he said those were going to clump over time anyway, and it would probably get worse after each surgery, which is what I was expecting. But he said they have not clumped back yet according to the MRI. So I'm just trying to gather all that information so I can put it together and see if I can get like a little file with some documentation for it.
Yeah, that's awesome, man. Really, really excited to hear that. And I'm praying for you, man. I'm glad to hear that you're having some success. Just keep peeling and sticking, man. That's the truth of the matter, is that he really can't explain it because your body's just healing.
Yes.
Your body is healing from these molecules that the light therapy is increasing in your body. So excited to hear that, and let's schedule something and have another discussion, man. See if we can put some other stuff together for you. Okay.
No doubt. Thanks a lot, Doc. I appreciate it.
All right, Ray, you got something real quick? and we'll go to Charlotte afterwards, okay?
Yeah,
Ray,
just real quick. I want David to share this with David, just quickly. I've been on the patches 2 years, David. And when I ran into when I was introduced to the patches 2 years ago, I had the lumbar 4 and 5 challenge. And the deal was, oh, we're just gonna do the surgery. I had put it off because I wanted a second opinion. And I was told that by Dr. Quila, the patch doctor, she said, Ray, if you're consistent, the body will remember how to heal itself. And I'll tell you, 2 years later, no brainer. And true to the point, they don't have an answer. I don't knock the medical industry. Our dear doctor's a medical doctor, medical surgeon. I don't knock them because I come to appreciate that they're just ignorant to what this is. And fortunately, we have those like Dr. Hubbard who are looking for the other side with his medical industry, history and knowledge and wisdom to help us all appreciate that there's a different science. There's a different sheriff in town. That's really what it is. And it's just about being consistent. So I just tell you, David, hang in there, be consistent. It works.
Oh man, thanks a lot. I appreciate that a lot, Mr. King.
Yeah.
Thank you. Thank you.
so true, Ray. I really appreciate you saying that, man, because I've been wearing the patches maybe a little bit longer than you have, and I still notice things. You know, I still appreciate that certain things are changing, and you know, it really is about that consistency. I completely agree. All right, Miss Charlotte, it's your turn. Go ahead and unmute yourself and ask your question.
Thank you, Dr. Jeff. My question is, what would be the best patches to use for soft tissue injuries?
Soft tissue injuries, okay? Can you be a little bit more specific? Give me a little background. Is this from a traumatic injury? Is this from general wear and tear?
It's from a fall. I was using a stick walker and coming out of someone's home, and they had repainted, and there was a hidden step, and they had forgotten to put the reflective tape on it as a warning. And so I kind of went head over heels. But I've been to several doctors and had x-rays and everything, and nobody seems to be able to help me. And I have been helped a little bit by the pain patches, but I know someone else who has a soft tissue injury now. So I wanted to see if I could possibly guide them.
Okay. So where is it most painful for you? Is it back? Is it hips? Is it a knee? What's really the area that's bothering you?
Well, most of it's gone, but I have some still in the shoulder.
Okay, in the shoulder. Okay. So I kind of go about pain in a couple of different ways. If it's acute pain, like in this particular issue, now I don't know how long ago the fall was, but like say for instance, the fall was a couple of days ago. And
it was 10 months ago.
It was 10 months ago. Okay. So in this instance, it sounds like you just have some underlying or lingering scar tissue, or maybe lingering sort of impact of the issue. So two things. X39 is obviously going to be the best long-term solution. Those stem cells are looking for inflammation. They're looking for damaged tissue. They're looking for tissue that's worn out and needs to be replaced. So over the longer term, that definitely should be a benefit to you. Okay. In the shorter term, EON is really great. Okay. EON is, it produces these neurotransmitters and these hormones that are really engaging in the inflammatory process. So it helps for the inflammation to go down. It helps for your body to respond appropriately from a neurological standpoint when you're moving your shoulder or moving whatever is bothering you, okay? Glutathione is also really, really powerful. And I would encourage you to stick those two patches together. It's what we call stacking. So you're gonna put them right on top of each other so that the fabric mesh is basically right in alignment with the fabric mesh from below. Okay. And then you would apply that wherever, directly on the pain itself. So if the pain is in the front of the shoulder, if the pain is in the back of the shoulder, if the pain is down in the deltoid, wherever it's giving you an issue, you can wear that combination during the day when you would be most active with the pain or most active with the shoulder or the area that's bothering you. And then you wear the X39 at night when your body's going to be resting, because that's the most appropriate time for those stem cells to go in and repair and rebuild tissue.
Oh, interesting. Thank you so much.
You're welcome. Icewave works too, by the way. But Icewave can be sometimes a little bit challenging. You have to find the right orientation for the tan and the white patch. And there's so many different schools of thoughts when it comes to that. That to me, it's easier just to deal with the underlying cause of the pain, which, 95 times out of 100, it is the inflammatory issue going on where your immune cells are still trying to go in and repair whatever was damaged. All right. Well, ladies and gents, I have 8:15 my time, so that we just a little bit over for the day, but no big deal. As always, this is so stimulating for me. I learned so much. It makes me excited about digging back into all of these different books and things that I've been coming in contact with to find out new and more creative ways to go about helping us get to our health goals and aspirations and achieving optimal wellness. Guys, this has been Ask Dr. Jeff. Again, my name is Dr. Jeffrey Hubbard. Please go to my YouTube channel. Just type in Jeffrey Hubbard, MD, and it should pop right up. I'm the only Jeffrey Hubbard medical doctor on YouTube. There are other Jeffrey Hubbards. If you go to Ask Dr. Jeff, you should be able to find me without issue. If you go to Google and you click videos and you put in Ask Dr. Jeff, I'm right there. There's another Dr. Jeff who's a veterinarian. He has a show on Animal Planet. I can't compete with him. He's been doing episodes on Animal Planet for years. He's got a bunch of different, episodes on there. But you can find me there. Subscribe, please. Check out the 71 and almost 72 different videos there are. In addition, I've got a bunch of other videos there just to check out. Guys, I'm on all the social medias. You can follow me and find out what's going on with me in all of those different capacities. One-on-one consultations are available for a fee. If you've got specific questions about a protocol that you'd like to design for yourself, if you got specific questions about patching, if you've got specific questions about my other tools in my tool bag other than Lifewave, please schedule a consultation with me. You'll be able to find my scheduling link in the description of my YouTube channel. Also, if you email me, I'll put that here in the chat. I can provide you with any information that you might like as well, okay? So, as always, I greatly appreciate each and every one of you for sharing this time with me, and I look forward to seeing you guys next Tuesday, all right? So just a little bit of info. I'm going to be traveling for the 4th of July, so I think we're going to cancel that Tuesday Ask Dr. Jeff, but we'll be right back the next week because I'll be getting ready to go to the Philippines. So we'll have a recap. We're going to do our Patches and Prayer Symposium from the Philippines. So guys, get ready for that. That will be awesome. And I'm just thrilled about the opportunity to go to Asia. This is going to be my first time going. So my teammate Jocelyn Alcina and several other people are going to be traveling with us as we gallivant across across the archipelago. We're going to be going to 3 or 4 different islands. We've got a lot of stuff planned on the itinerary, so I'm really excited. Again, guys, if you know anyone in the Philippines, if you know anyone from the Philippines here in the United States, they need to come to Ask Dr. Jeff Southeast Asia, which happens on Monday mornings at 7 a.m. Okay, that's 7 a.m. Central, 8 a.m. Eastern, and unfortunately, it's real early on the Pacific West Coast. It's 5 a.m. But guys, what we're talking about there is expanding our efforts into the Philippines and how much of an amazing opportunity that is to increase the Lifewave brand, to increase our own business opportunities, and to really make a huge impact and a huge difference for the Filipino community. I have just really been thrilled with my team and how they've responded. I encourage everyone to go to our patchesandprayers.com website and find out all of the cool stuff we're doing. Also, if you subscribe to my channel, you'll be able to see the previous 6 episodes of Ask Dr. Jeff Southeast Asia, where we're talking about all of the cool opportunities there are in the Philippines and talking to some really awesome doctors and sharing some really great insight about how this patch technology works, okay? We'll see you guys next Tuesday. Thanks so much for joining, and I appreciate it.